I'm going to talk about some of my new formulas, which is going to be very useful and very interesting for your daily practice. The first one I use a lot every day in my office is the Huang San. Wu means 5, Huang means yellow. So what yellow got to do with the medicine? That's from Taiwan native medicine, native herbs. Those Huang in Taiwanese, that means anti-inflammatory. So the 5 Huang, I put them all together for special purposes, is for your head actually. The Wu Huang San majorly focus on the head, not only the head, but the neck and shoulder. For the heat in the neck and shoulder. Well, but we should talk about the combination. But you don't have to remember all this. All the Huang, any herbs with the name of Huang, that means anti-inflammatory. It's very effective. I use this Wu Huang San for high blood pressure, for the neck pain, actually for all the head problem. How do you know this lady? I'm sorry, well, this patient has a head problem? We'll talk about later. This anti-inflammatory is most adaptable for this area, the neck and shoulder and everything in the head, eyes, nose, and the ears. Some people say, I have an ear problem, I have an eye problem, I have a mouth, we have a cold sore, or we have a runny nose, or allergy, or something. Even the face. I just saw a lady in my clinic today. I didn't look at her face in the beginning. I just take the pulse and say something. I said, your neck is like all swollen up, and your head is like a volcano. And when you have a volcano, it means a lot of heat in the body. And then after I'm done, she showed me that her problem. She was taking the prednisolone, the steroid. For what? For her swollen eyes and swollen face and mostly swollen lips. Her lips were so big. She showed me some picture in her cell phone that her lips was swollen like that. And the doctor gave her steroid like 60 milligram. Oh, it's a big one, huh? And cut down to 40 milligram and 20. But when she was taking the steroid, the lips become better. There were some photos in her cell phone. And when she stopped the steroid, the lips start swollen like so big lips again. So steroid is not working, just temporarily for the symptoms, but this is not working. When you stop it, it comes back again. And the 60 milligram is very high dosage for using steroid. So after I've finished my diagnosis system, my sequence, and I told her that your neck and shoulder, your head is all swollen up. Then I look at her face. It was really big, like a big head. So I use this one. For actually, a lot of patients in your office will complain, hey, I have an eye problem, I have an ear problem, I have a nose problem. It doesn't matter where. Everything in the head originated from here, especially including the headaches from high blood pressure. So whenever there's a fire, and the pulse with, usually I told the patient that, hey, your body's like a volcano. Now when I encounter this kind of a pulse, that's what I told them. Because the pulse is so expanding, big. The amplitude is high, and the pulse is swelling all directions. You just feel like you're touching something really gonna explode. So that's the time I told them that, hey, your body is like a volcano, like that. And of course, can I see this? This right hand side, huh? 寸关尺. Most of the time they have the problem here. The 尺 pulse can be a turtle, or you can say it's a big pulse, like in my pulse book, my pulse system, big pulse, but it's floating. So it's very jumpy, and when you touch down the vessel under the skin, you feel like this expanding. I use the word expanding all directions. like a swollen balloon or something, then you definitely can tell there are a lot of a problem in the patient's head. From here, the neck problem can be, actually the neck problem is the major source for all kind of problem. Not only the face, shoulder and in the front, because the cervical, the nervous system control the front. Even the cough. I have a patient. He was in my office today. A male, 70 something. He had a swollen throat and everything from radiation. He had cancer, and he could not swallow. And last time I gave you something to. Just when you have a patient he cannot swallow, of course you will focus on this area, the throat, and the tend to this point. Well, anyways, the upper respiratory system. He cannot swallow, so the doctor gave her a tube to feed him, and he wanted it to eat by himself because it's very painful and tasteless. So last time I gave him something here. In the beginning, I was also focusing on the throat, and I treated him twice or something. It didn't work very well. The last time I was focused on here, and the effect is very obvious. I use, you know what I use? 葛根芩连汤 and my 川芎茶调散. He didn't have any headaches. I used 葛根芩连汤 and 川芎茶调散. And the flax spur and the magic formula, 4 of them. My focus was on his neck, and his swallowing condition has changed a lot. 葛根芩连汤. Why am I using 葛根芩连汤? Because the neck is the taiyang channel, remember? So taiyang is connected to small intestine, right? This is a very important treatment trick. Okay, this is the first time I ever review this secrets. This is the left hand side, huh? The left hand side, the cun. If you feel it's like also a turtle pulse, I always draw a line here. That means these are 2 taiyang channel. Remember, this is the foot taiyang is the 膀胱经. This is the small intestine, also the hand taiyang. So whenever there's something like this, I use this formula. I use this combination. It helps a lot to hear. It can cure everything in the head. In the past, I was so frustrated from treating the tinnitus, the ringing ear. I always tell people that's not treatable, but not now. Now I can treat it from the point of here. By treating here, the ringing the ear will be better. In our traditional Chinese book, it says a ringing in the ear could be the kidney yang deficiency, the hormonal deficiency, or something, but it's not true. It's all here. So what I'm trying to tell you, if you're not sure about the people's problem, just try to focus on here. If you want to do acupuncture or cupping or scraping, of course you would do something about here. Not directly put needles in there, but you can put it on the channel. So what channel? This one, small intestine. If you feel the pulse on the left hand side, first we take the right hand first, right? We take the right hand, and when we reach the chi area, then we know, oh, you have a painful neck and shoulder. Actually, before we take the pulse, we look at the palms, right? Remember? That's what I always tell you. Because the right hand is folded. But let's try this a right hand. We look at their palms first before we take the pulse, right? So how do you know this guy has a problem with the neck and the head? You don't even have to take a pulse. You can tell them, you can keep on saying about his problem like 5 minutes without any mistakes. By looking at what? by looking at the shape of the fingers. So easy. The finger, if they're twisted or bended or something, that always means something here. So you can tell by the shape of the finger if they're twisted or bended or in a strange condition. Then you know that something wrong with the shoulder, neck and shoulder. And in addition to that, if you look at this 内关, the pericardium 6, this area, if this area, the veins are not green. I don't have a vein. That's a good sign. If the vein is white and pale, I always say, hey, your head is empty. They will say, why my head is empty? I always tell them that you have no blood supply in your head. You're going to have some dizziness and headaches. They always do. So, whenever there's a pale condition, that they will have headaches and whatever. But majorly, you should, before you take the pulse, you should look at the shape of the fingers. If the fingers are twisted or not straight, that means their neck are twisted. You can verify it by the pulse. If you don't, you're not so good with my pulse signs, and later on you can verify from the ear point. Can I have an ear? Huh? Oh yeah, here. Oh, okay. This area is very easy. This is the neck and shoulder. By looking at the shape and the color or something of here, then you can tell the nature of his neck. And then you can tell his related symptoms without asking. Don't ask. Just tell them. That if you see a black spot somewhere here, then you know you can directly tell them, hey, you had an old injury or car accident there. They always say yes. When there's a redness there, or the shape is not so pretty, it's not so ideal, then you can tell there's a lot of congestion, the neck and shoulder. Then his problem not only has the pain here, also have the pain in the head. That's why I invented this Huang San. I haven't finished yet. This is a good bonus for you. So when you have this pulse, you use that formula I mentioned here. 葛根青莲汤, 川芎茶调散, magic formula and the flex-spur. Or you can replace 葛根青莲汤 with my 五黄散.